Us now is Dr. Archana Chatterjee, Dean of the Chicago Medical School at Rosalind Franklin University of Medicine and Science. She also served on the FDA's COVID-19 vaccine panel. Doctor, we appreciate your time as always. I'd like to start with the kids in the ICU and the question I also just directed to Brian to get a little bit more clarity here. Are the kids that are ending up in the ICU and sick primarily from this Delta variant kids who have underlying health issues, or are these healthy kids that are now contracting COVID? Do we know?
We don't know the data for sure yet, Barney. We are hearing anecdotes from colleagues who are taking care of these patients that some of them do have underlying medical conditions, as you just heard, but many of them actually are perfectly healthy children who did not have any other medical conditions before they came down with COVID.
And as Brian just mentioned, there is some indication that obesity may play a factor. Is there any data on that you can shed light on?
Well, the risk factors for COVID that we know of in adults, such as obesity, diabetes, high blood pressure, et cetera, those same risk factors also apply in children. There's children who have underlying immune deficiencies, autoimmune disorders, things like that, that also place them at risk.
So what concerns you about the Delta variant, if in fact it is impacting healthy kids differently than COVID was months ago?
Well, the big concern, of course, is the rise in the numbers of cases among children, and especially the hospitalizations and ICU admissions, and in some cases, unfortunately, deaths. Children do die of COVID, not in the numbers that occur in adults, but we do see serious disease in children as well.
It always bothers me when people say it's rare in kids, but if it's your kid, it's not rare at all, and it hits close to home. Doctor, I want to talk to you about the boosters. Dr. Fauci came out recently saying that it is imminent that immune-compromised people get a booster shot, and at some point, he says everybody is going to need one. So will we need a booster, and how soon?
It's very difficult to say yet whether booster doses will be required for the general public. With regard to those who are immune compromised, there was a study that came out yesterday in the New England Journal of Medicine indicating that patients who had solid organ transplants did actually benefit if they got a booster dose, that their antibody levels actually increased significantly with a booster dose. So there is a good chance that that is going to be authorized by the FDA and recommended by the CDC. But none of those actions have occurred yet, and so we have to wait until those government agencies act on these data.
And I know we're all in a real hurry for information right now, and I'm asking you to look into your crystal ball a little bit here, but medically speaking, where will we be a year from now in terms of needing a yearly shot like the flu to fight COVID?
That is a very difficult question to answer, Marnie. We do know that the antibody levels that people develop after vaccination do decline over time, but we don't have what we call a serologic correlate of protection. That means we don't know exactly what antibody level you need to be protected against this virus. And so we are not sure of whether we will need annual vaccination or vaccination every few years. Those data are not available to us at this point in time.
How soon before it is?
Well, it's a matter of waiting to see what will happen. The antibody levels have been measured, the decline has been noted, but there is another part of the immune system, your immune cells, which can also react and respond to the infection. So we don't know what role those play. And the answer to the question really will be revealed over time.
Science is changing every day, doctor, as you know. You practice medicine in Chicago, where the number of people vaccinated has now surpassed about 70%. But right now, you're speaking to us from South Dakota, where 44% of people in that state have been fully vaccinated. I'm curious what differences you're seeing and what conversations you're having with people in these two very different spots.
Well, we try very hard to convince anyone who is not vaccinated and is eligible to be vaccinated to go ahead and get a dose of the vaccine. There are very good data that these vaccines are safe and effective and should be used. And it is mind-boggling to me to see people continuing to hesitate or refuse the vaccines when we have all of this safety and efficacy data available to us. So I think the most important message that I can give anyone tonight is that if you are unvaccinated, and you're eligible for a vaccine, please go ahead. For the sake of your loved ones, for your own health, please go ahead and get vaccinated.
And doctor, before I let you go, Florida is rolling out a plan to dispense Regenron monoclonal antibodies through some mobile clinics. What are your thoughts on this type of treatment, how it works, and is it an option for some other states?
So Regeneron is a pharma company that makes a cocktail of antibodies against COVID. And it's been shown to have some modest effect, especially early on in the illness. The way that it was studied is actually in hospitalized patients. So in terms of giving it to patients who are not yet in the hospital, it's really difficult to say how effective it will be. These therapies are extremely expensive, so they do work when given relatively early in the illness, but it's an expensive treatment, and a much better way to avoid this infection altogether, to avoid disease from this infection, is to get vaccinated.
Dr. Chatterjee, as always, appreciate your time. Thank you.
Thank you, Marnie.